In this video, you will learn why onions, despite their reputation as a superfood, can be extremely dangerous in certain situations. We will explain under which conditions it is absolutely forbidden to eat onions, which illnesses they can worsen, and what research says about it. You will receive not just a list of prohibitions, but also valuable advice for maintaining health and promoting longevity. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. 1. Never eat onions if you have blood clotting disorders. Onions have long been considered beneficial for blood vessels due to their rich content of flavonoids, especially quercetin, and sulfur-containing compounds. However, these very substances make onions potentially dangerous for individuals with blood clotting disorders. Quercetin can reduce platelet aggregation, the process by which blood cells form clots, by 30 to 50%. This means that the body loses its ability to quickly stop bleeding in the event of an injury or internal damage. In the United States, more than 3 million people live with diagnoses that involve impaired blood clotting, including hemophilia and von Willebrand disease. Additionally, a large number of people take anticoagulants, medications prescribed to thin the blood after heart attacks, strokes, or for atrial fibrillation. If they regularly consume onions, the time required to stop bleeding increases by an average of 2 to 4 minutes, which in the case of serious injuries or surgeries can lead to a life-threatening situation. This is particularly dangerous for elderly individuals over the age of 65, whose ability to heal tissue is already reduced and who are at a higher risk of falls. Medical studies have shown that 7 out of 10 patients with blood clotting disorders who consume large amounts of raw onions have an increased risk of both minor and major bleeding, from nosebleeds and gum bleeding to internal hematomas. If you have already been diagnosed with a blood clotting disorder or are taking blood-thinning medications, you should either completely eliminate raw onions from your diet or be sure to discuss their consumption with your doctor. 2. Never eat onions if you have gallstones. At first glance, onions may seem like a harmless vegetable. However, for people with gallstones, they can pose a serious threat. Onions have a pronounced choleretic effect. They stimulate the production and release of bile by almost 50%. For a healthy person, this can be a beneficial property, helping digestion. But for someone with gallstone disease, it is very dangerous. According to American medical associations, more than 20 million people in the United States have gallstones. What makes this especially insidious is that, for most people, the disease remains asymptomatic for a long time. When someone with undiagnosed or known gallstones eats a large amount of onions, the risk of an attack sharply increases. The stimulation of active bile production by onions can provoke the movement of stones. If a stone gets stuck in the bile duct, it can cause an intense pain attack known as biliary colic, which requires urgent hospitalization. Statistics show that in 60% of patients with stones larger than 5 millimeters, pain worsened within 1 to 2 hours after consuming food rich in onions. In some cases, surgical intervention was necessary to eliminate the blockage of the bile ducts. If you have been diagnosed with gallstone disease or have a predisposition to it, such as women over the age of 40 with excess weight whose risk increases by 2 to 3 times, it is better to avoid regularly consuming large amounts of onions, especially in raw form. 3. Never eat onions if you have severe kidney failure. The kidneys are the organs responsible for removing excess potassium from the blood. When their function is impaired, even a slight increase in potassium levels can lead to very serious consequences, including dangerous heart rhythm disturbances and even cardiac arrest. Although onions are considered a healthy vegetable, they contain a relatively high amount of potassium, about 146 milligrams per 100 grams of product. For a healthy person, this does not pose a threat, but for individuals with advanced stages of kidney failure, it can be extremely dangerous. In the United States, about 785,000 people live with end-stage kidney failure, in which the kidneys are unable to effectively filter the blood. Excess potassium in the blood of such patients quickly leads to hyperkalemia, a condition in which the muscles, including the heart muscle, may stop functioning properly. According to doctors' observations in patients undergoing dialysis or with severely reduced kidney function, an increase in potassium levels after consuming potassium-rich foods, including onions, is recorded within 2 to 3 hours. Even a single meal containing a large amount of raw onions can raise blood potassium levels by 0.3 to 0.5 millimoles per liter, which becomes critical when the kidney's filtration ability is already compromised. Therefore, for all individuals with kidney failure, strict control over the intake of foods high in potassium is essential for survival. In such cases, onions are either completely eliminated from the diet, or their allowable amount is determined only under the supervision of a doctor or dietitian. 4. Never eat onions if you have serious heart diseases. Many people believe that onions are good for the heart. They can indeed lower blood pressure and improve the elasticity of blood vessels. However, for individuals already suffering from severe cardiovascular diseases, such as chronic heart failure, ischemic heart disease, or arrhythmias, this so-called beneficial effect can turn into a real trap. The key is that the active compounds in onions, including quercetin and sulfur-containing substances, cause blood vessels to dilate and reduce vascular resistance. This leads to a rapid drop in blood pressure and can cause a redistribution of blood flow. For someone with a weakened heart, this results in decreased blood supply to the brain, dizziness, weakness, and fainting. This effect is especially pronounced if the patient is taking cardiac medications such as ACE inhibitors, beta blockers, or diuretics. Studies show that in such patients, onions can enhance the effects of medications by up to 30%, causing an excessive drop in blood pressure or amplifying side effects. For example, according to the American Heart Association, 1 in 6 patients with heart failure who regularly consumed onions experienced episodes of nighttime tachycardia, unstable blood pressure, and swelling. Thus, in cases of severe heart conditions, even an everyday product like onions can disrupt the functioning of the cardiovascular system. If a person previously felt stable while taking medications, the introduction of large amounts of onions into their diet could lead to destabilization. Therefore, individuals with heart diseases should approach the consumption of onions with caution and always consult their doctor. 5. Never eat onions if you are taking anticoagulants or antihypertensive medications. If you are taking medications to lower blood pressure or thin your blood, onions can unexpectedly turn your treatment course into a source of risk. This is because onions can affect the same mechanisms targeted by these medications. For example, quercetin and other biologically active compounds in onions are capable of dilating blood vessels and slowing blood clotting, exactly the actions performed by antihypertensive medications and anticoagulants. If you are taking warfarin, aspirin, clopidogrel, metoprolol, losartan, or similar medications, consuming a large amount of onions can enhance their effects by 20 to 30%. This can lead to consequences such as a sharp drop in blood pressure accompanied by dizziness and weakness, internal and external bleeding, an increased risk of hematomas even from minor bruises and more frequent nosebleeds or gum bleeding. Statistics show that about 1 in 5 patients undergoing antihypertensive or anticoagulant therapy who regularly consume onions experience side effects requiring medical adjustment. The risks are especially high among elderly individuals and patients with comorbidities, such as diabetes or kidney failure, where compensatory mechanisms are already impaired. Therefore, if you are taking the mentioned medications, it is not advisable to carelessly add large amounts of raw or cooked onions to your diet. A consultation with your doctor will help balance your diet without interfering with the action of your medications and without putting your health at risk. 6. Never eat onions if you have low blood pressure. Onions have a pronounced vasodilating effect due to their bioflavonoids and sulfur-containing compounds. For people with high or normal blood pressure, this can be a beneficial property. However, for those who suffer from hypotension, onions can cause serious problems. After consuming approximately 100 grams of raw onions, blood pressure drops on average by 5 to 7 millimeters of mercury. For a person with normal blood pressure, this change is almost unnoticeable. But for individuals with hypotension, whose blood pressure is already low, such a drop can lead to an acute shortage of oxygen in the brain, causing dizziness, weakness, darkening of vision, and even fainting. This is particularly dangerous in older adults or in cases where hypotension is combined with varicose veins, impaired cerebral circulation, and other vascular problems. American studies have shown that about 20% of people with hypotension who regularly consumed large amounts of onions reported worsening well-being, dizziness when changing body positions, and an increased number of fainting episodes. If you are prone to low blood pressure, it is better to limit the consumption of large amounts of raw onions and be sure to monitor your condition carefully. 7. Never eat onions if you have diseases of the pancreas. The pancreas is one of the most vulnerable organs of the digestive system. It is responsible for producing enzymes necessary for the breakdown of proteins, fats, and carbohydrates. When a person is healthy, moderate stimulation of the pancreas by foods like onions does not cause problems. However, in cases of pancreatitis or other disorders, the functioning of the pancreas becomes unstable, and any additional stimulation can trigger a flare-up. Onions, especially in raw or fried form, stimulate increased secretion of digestive enzymes. This happens due to active compounds, organic sulfur-containing substances, which irritate the mucous membranes and enhance the reflex activity of the gland. For an inflamed pancreas, such stimulation causes serious stress. The organ begins producing enzymes at a time when it is not needed, leading to self-digestion of tissues and a worsening of inflammation. According to the Gastroenterological Association, 42% of patients with chronic pancreatitis who consume dishes containing onions experienced a deterioration of their condition within 3 to 6 hours. Symptoms included pain in the upper abdomen, nausea, occasional vomiting, and increased bloating. Flare-ups were especially common after eating fried onions, when their volatile compounds become even more aggressive toward the digestive mucous membranes. This is why doctors strongly recommend that people with pancreatitis completely eliminate raw and fried onions from their diet. In some cases, a small amount of boiled onions may be allowed in dietary soups or stews, but only after consulting a gastroenterologist. 8. Never eat onions if you have gastritis or peptic ulcer disease. Onions are vegetables with a very active chemical composition. They are rich in essential oils, enzymes, and organic acids, which, upon contact with the stomach lining, can cause irritation. For a healthy stomach, such stimulation can even be beneficial by improving digestion. However, for people with gastritis or peptic ulcer disease, onions present a real threat. In gastritis, the stomach lining is already inflamed, and in ulcers, there may be actual defects or open wounds. Contact with the aggressive substances in onions intensifies inflammation, causing spasms, burning sensations, and pain. Raw yellow and red onions are particularly dangerous because they contain the highest amounts of irritating compounds. Green onions or boiled onions are much gentler, but even they can cause problems during an acute phase of the illness. Clinical studies have shown that 8 out of 10 patients with gastritis or peptic ulcer disease experienced a worsening of symptoms after eating dishes containing raw onions. They reported increased heartburn, pain in the epigastric area, and a feeling of heaviness and fullness in the stomach, even after a light meal. In some patients, small bleedings from ulcers were recorded, requiring urgent medical intervention. Therefore, for any chronic stomach diseases, onions, especially raw onions, should be completely avoided. Even small portions can trigger serious deterioration. Dietitians recommend replacing onions with gentler foods such as boiled vegetables or mild green herbs like dill. 9. Never eat large amounts of onions if you are overweight or have a metabolic disorder. Onions are usually associated with being light and low in calories. However, for people with obesity, metabolic syndrome, or insulin resistance, this product may not be as harmless as commonly believed. Onions, especially when consumed in large quantities and in raw form, can affect blood sugar levels. They stimulate the production of insulin, the hormone that regulates glucose levels. For a healthy person, this helps the body manage food intake. But in individuals with impaired insulin sensitivity, the body reacts inappropriately. Under the influence of onions, it releases more insulin than needed, leading to sharp spikes in blood sugar levels, followed by sudden drops, a condition known as hypoglycemia. In studies conducted by American endocrinologists, it was found that with high onion consumption, more than 100 grams per day, patients with metabolic syndrome experienced blood sugar fluctuations 15% more frequently. These fluctuations were often accompanied by fatigue, episodes of intense hunger, and even tremors. Additionally, these patients showed an increased craving for carbohydrates, leading to overeating and further weight gain. Onions can also affect the hormone leptin, which regulates the feeling of satiety. With chronic overeating, leptin regulation becomes disrupted, and the addition of large amounts of onions to the diet can worsen this imbalance. As a result, people with obesity may unknowingly consume more calories than necessary. Thus, despite their reputation as a healthy vegetable, onions can interfere with weight stabilization and worsen insulin resistance in cases of metabolic disorders. This is especially true for dishes containing large amounts of fried or caramelized onions, where the glycemic load is even higher. 10. Never eat large amounts of onions during pregnancy. Pregnancy is a special period when even familiar foods can unexpectedly affect the health of the mother and the baby. Although onions are rich in antioxidants and vitamins, excessive consumption can pose a risk. The active substances in onions stimulate intestinal peristalsis and increase the activity of the gallbladder. For a pregnant woman, this means a risk of heightened smooth muscle tone, not only in the gastrointestinal tract but also in the uterus. Consuming large amounts of onions is especially dangerous during the first trimester, when the placenta is actively forming. Statistics show that about 18% of women who consume significant amounts of onions, more than 100 grams per day in raw form, experience signs of increased uterine tone and the threat of pregnancy interruption. These findings have been confirmed by studies conducted in obstetric clinics in the United States. Additionally, in some women, excessive stimulation of the intestines by onions causes bloating, which further irritates the uterus and increases its sensitivity to contractions. There is also the risk of developing allergic reactions, which can manifest more severely during pregnancy. To avoid unnecessary risks, pregnant women are advised to limit the amount of onions in their diet and to consume them in cooked form rather than raw in order to reduce their stimulating effect. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.